So acupuncture is fantastic in pain and injury rehabilitation. What it does is actually brings a lot more blood to the area. So, for example, if you've injured your shoulder, a lot of people, it's a common injury to injure the shoulder, we can give some acupuncture in the local area, but also we can do what's called distal needling. So we can do needling that's elsewhere in the body that can help the shoulder. Now, if you have a tear or if you have a muscle problem or something like that, then what we can do is actually work through a program for you to get your shoulder or any other part of your body back to order. And what we normally do is weekly treatments, can be bi-weekly for an acute injury, and we can work through a system and get you rehabilitated properly. So acupuncture is fantastic for back pain and spinal pain. It's a common complaint for someone to come in with a low back disc problem, and it's because what actually happens is people aren't watching what they're doing when they're picking up, moving things, or if they just clumsily grab something. Acupuncture actually goes in to the spinal area and reduces the inflammation, allowing the disc then to retract back inside the spinal column. With acupuncture, it can reduce the inflammation. A lot of the time with back injuries, inflammation is what's giving most of the pain, and inflammation is what's giving a lot of the reverberating pain down the legs and things like that. And that inflammation is actually pushing out onto different, say, nerves and things like that. Now acupuncture goes in there, reduces that inflammation, and allows for those nerves to be moved freely throughout the tissue, and therefore giving you less pain. Acupuncture is really good at reducing inflammation inside the knee socket. It does this by bringing a lot more blood to the area, but also turns on different markers in the body to actually tell the body that this area is injured. A lot of the time with the injuries, and that's what happens with a lot of chronic injuries, the body doesn't see it as a threat, and what it does is the body sort of gets used to having the pain there and having the inflammation there. So what we actually do is we go in, we turn on all of the markers, which then allows the body to say, okay, this is where there's an injury, and let's go and target this area and rehabilitate the area.